I'm Carlos Cordon-Cardo, and I'm the chair of the Department of Pathology, Molecular and Cell-Based Medicine at Mount Sinai Health System. So we are very fortunate that Mount Sinai School of Medicine has an outstanding Department of Microbiology. They were in the field in China very early on during the outbreak. We were able to produce research tools that they are of great relevance, and working with Dr. Florian Kramer, we realized that tests that they were putting together to analyze the antibodies that can be produced against this virus in the immune response were of potential clinical relevance. We took these observations from the research labs in microbiology and we brought it into the clinical context of regulation in our clinical laboratories, and realized very early on that they were highly specific and sensitive. Tests need to be robust, and they need to have a great deal of specificity and sensitivity, meaning that we need to avoid tests that can falsely identify people that they are positive or that can falsely identify people that they are negative. That's what sensitivity and specificity really stands up. You want to know that if you are being called as a positive individual, that you really do have these antibodies in your blood and that you are immunized. So the antibody test that has been generated at Mount Sinai has the purposes of identifying two different proteins that can assess if you have seen the virus, meaning that you have created an immune response and you have produced antibodies against this virus that will protect you into the future, but also to assess if your level of antibodies are low, intermediate, or high. People that have a very rich antibody blood may be able to help individuals that are very ill with a clinical trial of what we call convalescent plasma. It will also help in identifying those individuals that can, now that they are immune, can open our society, go into the healthcare frontline, or in the future into other critical areas that we would like to see a society being protected. Police department, firefighters, teachers, and in the future also the other areas of our community that we would like to open and go back to the life that we used to have. Nothing of that would have happened without a great collaboration with basic scientists in microbiology, in immunology, with clinicians that are in the front line, making sure that we were able to receive all of the clinical samples that were needed for testing, for validating, and then for implementing the test, from infectious diseases to terrific colleagues in the ICU and in other areas of the hospital. Also, regulatory agencies. I have never seen so much help from the New York State Department of Health and from the FDA, guiding us and assisting us in the writings and the applications. And finally, leadership that has understood the relevance from our institutions to others and being able to share in a completely open, transparent way the knowledge that we were getting and deploying now these tests, not only in our institutions, but in others.